Have you ever had a situation where either you or your teenager has this uncontrollable urge to sleep, where you feel like you're sleeping everywhere? And this is not an issue of just, oh, maybe I didn't get enough sleep. You are getting enough sleep, but during the day, you're still sleepy. It seems like you just can never seem to have enough time in the day to sleep, and you're constantly thinking about your bed. You're waking up feeling okay, and then you're constantly falling asleep on car rides, in school, in classes, all of that. And then something mysterious happens too. Maybe when somebody startles you, you suddenly start to feel very sort of shaky. Maybe you feel a bit weak. I am describing a condition called narcolepsy. And today we're going to be delving into what narcolepsy is. It's not just about falling asleep. We're going to be talking about what it is, what it's not, how to figure out if you have it, and how to treat it. So stay tuned, because this is really going to change your life or the life of somebody that you love. And I'll start with a story. So I had a patient some time ago who was, later on, maybe like in his mid 40s, and was profoundly sleepy all the time. And these symptoms seemed to just get worse as he got older, to the point where if he was driving, very, very key to the history. If he was driving, he needed to hold on tightly to the steering. And if somebody just surprised him suddenly, he would find himself feel so weak. In fact, it got to the point where he stopped driving because he really couldn't trust that he would be able to hold steady to drive his kids to school or to their activities. So these symptoms were affecting his entire life. He was really struggling with this and had been told, well, maybe you just have something, maybe whatever. And at this point, by the time he came to see me, he was on medications for depression, anxiety, all of that. And we were able to walk through that to figure out what was going on. And so I want to share about what narcolepsy is. And what I want you to understand is that you may have seen these symptoms, maybe bits and pieces of it, but at the end of this talk, my goal is that you have every clarification you need so that you can determine if we need to, test you, if you need to see a sleep specialist, or to at least talk to your doctor to figure out what exactly is going on. So what is narcolepsy? So narcolepsy is a chronic neurological condition, meaning that it's a brain issue. It is chronic, meaning that it's not something that happened for 2 weeks and that's it, right? It doesn't go away. It's a chronic neurological condition where you have an uncontrollable urge to sleep. And if you've been on here and you followed me for a while, you know that I always talk about sleep quantity. So you have enough sleep. As an adult, maybe you're getting 8 hours of sleep, but you're still constantly sleeping. And you are really struggling. It's impacting your day one way or the other. Now, what could potentially be contributing to you feeling sleepy all the time? You might have another sleep disorder. So that's why it's not just about falling asleep. It's not just about being sleepy all the time. It comes with a few other symptoms. And before we even go into those symptoms, let's talk about how this develops. Where is it coming from? Is it a virus? Is it trauma? What on earth is going on? And there are a few theories around what causes narcolepsy. The first is what we call hypocretin deficiency. What is hypocretin? Hypocretin or orexin is a brain chemical or neurotransmitter is what we'll call it, that helps with what we call regulating your sleep wake switch. So in the brain, your brain knows when it's supposed to be awake, when it's supposed to sleep, because there's a balance of certain chemicals in your brain. And so that entire system is off. One of the enzymes that we found out, one of the neurotransmitters we found out, is hypocretin is deficient. And they've done blood work where they check, or they do a spinal tap to get fluid from your brain. And they've seen that certain patients with narcolepsy have low hypocretin. I'm saying certain patients because some patients don't have a low hypocretin. And maybe that will take us to the types of narcolepsy. You have narcolepsy type 1, narcolepsy type 2. For the type 1, the hypocretin tends to be low. For type 2, the hypocretin is normal. So of course, that also affects the kind of symptoms that you can get, which again, we'll move on to later. So hypocretin deficiency is found to be one of the causes. Another cause that we found out is autoimmune. So some autoimmune issues can predispose to a lower hypocretin or to narcolepsy symptoms. And then you also have genetic factors. So there's a family history of narcolepsy and you're feeling sleepy, you definitely want to get tested for narcolepsy. And so these are just a few. Another thing that we've seen in a few patients is trauma. So if there's been a history of head trauma, as well as certain viruses, we're finding that there's a higher incidence of narcolepsy in those populations. Again, not everybody. So this is why we kind of have to take this as a case-by-case basis. Okay, so that's basically the entire, cause summarized. Now we'll move to clinical symptoms. What are the symptoms of narcolepsy? There are 5, which we call the pentad, meaning 5 classic symptoms of narcolepsy. The first is excessive daytime sleepiness. So this is, again, that uncontrollable urge to just fall asleep. And if you go to your sleep doctor, they would have you checked. They'll have you fill out a form called the Epworth Sleepiness Score. And so that will help to figure out how sleepy you are, right? So 0 to 10 is normal. Anything greater than or above 10 is abnormal. So that's excessive daytime sleepiness. And this is not just, oh, I'm a little bit sleepy in the morning. This is sleepy all day. And I tend to see this where students are in college or they're in high school, they're falling asleep in class, they're falling asleep when they should be hanging out. They're really, really sleepy. The second symptom we tend to see is what we call cataplexy. And this is defined as the sudden loss of tone with emotion. So remember my patient sitting, driving, and then suddenly surprised, and they would feel very weak, right? So this weakness, people will say they might feel weak to the point where they crash and they fall down for a few seconds. Some will feel weak and they can steady themselves. Some will have just partial loss of certain muscles in their face or in their arms. And so we need to ask questions very detailed, right? To be very careful. In fact, I had a patient once that said every time anybody cracked a joke, he would try very hard not to laugh, because once he laughed, he would start to feel that weakness come upon him. And it's really literally your entire tone in your body just goes out. Another symptom you might have is what we call sleep paralysis. And so sleep paralysis is exactly what it is. You're asleep and then your muscles are paralyzed, but then you wake out of sleep and your muscles are still paralyzed. And the phenomenon between that sleep paralysis and cataplexy is what we call REM intrusion or wakefulness. So we've had talks before where we talked about the different stages of sleep. So there's a stage of sleep which is called REM, or rapid eye movement sleep. And so what happens then is your muscles become actually paralyzed, except your diaphragm, so you're able to breathe, and your eye muscles, so your eyes are moving very fast. That's why we call it the rapid eye movement. So with cataplexy, narcolepsy, you have an intrusion of REM into wakefulness. So your muscles are paralyzed, but you're awake, and that's because that sleep-wake switch is broken. So you might have excessive daytime sleepiness. You might have cataplexy, especially if you have type 1 narcolepsy. Type 2 patients with type 2 narcolepsy do not have cataplexy. You might have sleep paralysis. Another thing you might start to have is hallucinations. Again, it's that REM intrusion. And what are those hallucinations? It's almost like you're dreaming, but you're awake. That's the best way you can describe it. So you're about to fall asleep and you're hearing voices or seeing things that are not there. Those are hallucinations, and we see that in patients with narcolepsy. And then the fourth thing is disrupted sleep. So I'm telling you, you're constantly sleepy, but yes, you still have a lot of sleep fragmentation. So your sleep-wake cycle is unstable, right? That sleep system is unstable. So sometimes you're waking up in the middle of the night. Sometimes you're sleeping during the day. Sometimes you have REM during the day. Sometimes you have it at night. So things are just all over the place. And as a result of that, you have a lot of sleepiness. So not everybody has all 5, right? I told you for narcolepsy type 1, you will have cataplexy. Most times you might develop it later. For narcolepsy type 2, you tend to not have cataplexy. So what next? How do you figure this stuff out? So you have this history. Some of this is starting to sound familiar. One of the things you need to do is figure out, do we have it or do we not? Because if you have a diagnosis of narcolepsy, it is life-changing. And being aware of that, being aware of accommodations, being aware of what life looks like on the long term is important. The diagnostic test for narcolepsy is what we call a polysomnography and a multiple sleep latency test. So in English, that just means an overnight sleep study. And why do we get an overnight sleep study? We want to just kind of see a sense of what your sleep overall looks like at night. Do you have apnea? Do you have anything else that can be contributing to your daytime sleepiness? which of course we should have figured that out when we see you in clinic. And then a multiple sleep latency test is you do 5 naps. You get 5 nap opportunities during the day, and we figure out how likely are you to fall asleep within each nap. And so we do some calculations. That MSLT gives us what we call a mean sleep latency. If it's less than 8, then you have suspicion for narcolepsy. And if during those naps you actually get into dream sleep, which is REM sleep, typically when you nap, you shouldn't hit REM unless you've been napping for a very long time, then we say you have narcolepsy. And then there's some parts of the overnight study test that we can actually use to determine that as well. So a whole lot of things go on. Listen, this may seem like a lot, but I just want you to take this information so that when you do see a sleep specialist and they're walking through, you're like, Dr. Brown talked about this on the Restful Sleep MD show, and it sounds very familiar to you. So you have these symptoms. We figured out what your symptoms are. We've decided you need a sleep study. You do a sleep study, and it comes back and shows narcolepsy. Now what? Now what? So now we'll talk about the different treatment options for narcolepsy. There are 2 broad categories of treatments. There's what I will call the non-pharmacologic or lifestyle changes, and then the pharmacologic changes, which are the medications, right? So lifestyle, no matter what medications you're going to be on, it is important that you really start to alter your lifestyle a little bit to support this, to help support your sleep health if you have a diagnosis of narcolepsy. Even if you don't have a diagnosis of narcolepsy, lifestyle is key. So what does that look like? Scheduled naps. Right. So usually one of the things I tell you is if you have sleep issues and you need a nap all the time, it might mean that you have a sleep issue, right? This is actually one of the sleep disorders where a nap is recommended because, again, you have that sleep week schedule that is off and you might feel very tired during the day. So having a scheduled nap either at school or at work where you could take a nap earlier in the day, it's still a power nap. So 20 to 30 minutes just to take the edge off is super helpful. The second thing you might want to make sure you're doing is sleep hygiene. So now you have this condition. It's really important that you optimize your sleep. You get enough sleep hours. You avoid using devices during sleep. It's really important that you eat healthy. Limit caffeine use prior to bedtime. Avoid alcohol before you go to sleep, right? So you're still following those sleep hygiene tips, which we talk about again and again and again and again. And then the third thing I would say is making sure that your diet is optimized, right? So you're eating whole grains. In fact, we have a nutritional part of our narcolepsy treatment where we talk through what kind of things that you should eat. Whole grains. Sometimes you may need to avoid high carb content. You really want to avoid processed meals. In some situations, I have people just avoid things that, are too high in sugars. Like all those things will drive up your cortisol level. All those things will drive up your sugar levels and can contribute to daytime fatigue. So this is also part of your treatment. And then finally, work and life accommodations. This is a chronic neurological condition. So what are you doing at work, right? Are you operating heavy machinery? Are you driving all the time, like our dear friend who I saw in clinic and had to stop driving? Are you a student where you need accommodation so you're not falling asleep during your tests? So this is where really you work very closely with your doctor to create lifestyle accommodations to support you so that you can thrive in spite of this diagnosis. So finally, we're going to talk about different categories of medications that you can use. The first is what we call the stimulants. Okay, what are stimulants? They stimulate you. So caffeine is a stimulant. Medications like, methylphenidate, you may have heard of things like that. Ritalin, you may have heard of Concerta. You can imagine those medications are stimulants. They're almost similar to the medications we use for ADHD. Those are proven to be helpful for patients with narcolepsy. Of course, they have their side effects, which you have to figure out if that's going to be suitable for you. Another group is what we call the wakefulness promoting agents. So one of these medications is what we call modafinil or armodafinil. So what these do is they actually are specifically focused on treating patients who have narcolepsy, and they promote that state of wakefulness. They may have some of the less side effects than the stimulants, depending on the type of stimulants you use. And then the third category is what we call the oxybates. So oxybates are actually something that's present in our brain. And so sometimes when you don't have the sufficient amount, it can actually impact sleep. So what it does is it stabilizes sleep especially overnight. It helps with, that off disrupted sleep. It helps to consolidate sleep. So this is a medication you actually take before sleeping, and then it kind of lasts for majority of the night. There are two types. There's the double dosing, which you take twice at night. So that means you take one dose, you wait about 2.5 to 4 hours and take another dose, and it stabilizes your sleep. And then you have the single dosing one, right? So that type, you actually take it and it lasts more hours. So an example of that is what we call the Lumryz. The other one that I talked about, the double dosing, is what you may have read as Xywav or Xyrem. So again, you will speak with your doctor to figure out which one of these medications is best for you. And then another group of medications we often talk about are antidepressants. So some of these antidepressants can actually help with your sleep. It can stabilize your sleep and can also help in eliminating or decreasing the symptoms of cataplexy, that loss of tone. So that's absolutely one of the medications that you might need to take as well. And then finally, the last group are the newer medications. So one of those is what we call pitolisant. I like this medication because it's not habit forming, it's not a controlled substance. And so it's also a great option in some situations for patients who have narcolepsy and cataplexy. So a few of the medications help with narcolepsy and cataplexy. A few of them only focus on the narcolepsy type 2, meaning that narcolepsy without cataplexy. So really important to figure out what your needs are, really important to figure out what your symptoms are, and have an extensive conversation with your healthcare provider to figure out what exactly you need. So I know I packed a lot in. This is the kind of video you're going to have to save, share with anybody that's, struggling in your community with sleep. You may need to speak with your doctor and say, hey, do I have the symptoms? Can we get a test so that I can figure it out? Or better still, come see us. We are at the Restful Sleep Place, and we provide sleep services for children and adults with sleep issues. So we have patients who have narcolepsy and patients who have other symptoms. I'm going to share another video that talks more about the other types of causes of excessive daytime sleepiness. And I think it's really important to think about this, because I don't want you thinking, oh my goodness, I have narcolepsy and running around. Maybe you don't. Maybe you have idiopathic hypersomnia. Maybe you have sleep apnea. Maybe you have another sleep condition. So it's important that we take this holistically. And so I hope this has been helpful. You can visit us, give us a call at the Restful Sleep Place, 215-607-8297 to schedule an appointment, or visit our website at therestfulsleepplace.com. Again, we offer holistic sleep solutions, and so we'll be more than happy to help you. And until next time, I hope you rest well.